All right, let's welcome our next guest, Director of Aging, Susan DeMarois. Susan joined the California Department of Aging as director on November 1st, 2021. Before joining CDA, Susan led public policy advocacy for the National Alzheimer's Association in California. As a registered lobbyist in Sacramento, Susan advocated for legislative, budget, and regulatory changes at the state capitol on behalf of 2.1 million Californians directly impacted by Alzheimer's disease. So the organization led the effort to implement the Healthy Brain Initiative in California, resulting in a $5 million investment in state's public health infrastructure. That's a lot of money. Susan served as an appointee to Governor Newsom's Alzheimer's Prevention and Preparedness Task Force, chaired by former First Lady Maria Shriver. Very impressive. In addition to the Master Plan for Aging Stakeholder Advisory Committee, a work group established by executive order, Susan also represented Alzheimer's Association on CHHS Agency Secretary's Alzheimer's Disease and Related Disorder Advisory Committee. Now, before working for Alzheimer's Association, Susan led government and community relations for UC Davis Health System and its academic medical center, Children's Hospital, Medical School, Nursing School, Physician Group. This is a graduate of CSU Chico. Susan started her career working for U.S. Congress and California State Assembly. Susan is a proud mom to 2 adult daughters. That's a big accomplishment. She resides in Sacramento, California, and draws inspiration from her work, from her own mom's experience with dementia. Director DeMarois, the floor is yours. And I apologize if I mispronounce your name.
Hi there, Bobby. Thank you for that very nice introduction. I appreciate it. And I'm really happy to be here with you all today. Thank you for this invitation. And I want to be sure that there's plenty of time to hear from you so that since I'm joining you midway through your meeting, to hear what's most important. So I wanted to just provide a few updates for you and then be sure that we have time for a conversation and a dialogue. And I'll start by just wishing everyone a happy new year. And today, as Bobby said, is day 80. I've been in this job as director of the Department of Aging going on 3 months. And it's I'm just loving it. I love this role, and it's a huge honor to serve in the Newsom administration and to work for California Health and Human Services Secretary, Dr. Mark Galley, the team of departments around our state in the HHS agency. And most of all, it's just a privilege to represent the Department of Aging and the team and staff who work so hard at CDA. So I'm very happy to be here. And today, there's a lot to celebrate. I have, good news to bring, and it's of course tempered by what we're all facing today with the Omicron variant of COVID-19 and the pandemic that continues into its 3rd year. So I wanted to start with the good news and what we're celebrating starting tomorrow. Many of you are probably familiar with California's Master Plan for Aging. And tomorrow marks the 1-year anniversary of the launch of that report. And we have a celebration planned where we expect to hear by video from the governor, and we have several cabinet secretaries and a wide variety of stakeholders from the aging and disability community joining us. I'm going to put a link in the chat so that anyone who wants to join can join tomorrow. It's from 10:30 to noon. But we're very excited to celebrate what we're calling record progress in record time. Quite a bit has been achieved in the past year. And for those who aren't familiar with the Master Plan for Aging, this started before Governor Newsom even took office. There was a groundswell of community support among aging and disability advocates calling for a master plan for aging. We have a master plan for higher education. We wanted one to chart a course for our later years of life and the growing demographic in our state and nationwide of older adults. The governor on the campaign trail said he would make that a priority, and he did. From his very first public address, in his State of the State address, following in his budget, and then in his first summer in office, he issued an executive order that called on California to establish a master plan for aging. He appointed stakeholders from every part of our state, and the group met, and their first meeting was in person. And then soon the pandemic struck, and they continued, they pressed on. In fact, they doubled down during COVID because of the disproportionate impact of the pandemic on older adults and people with disabilities. And they produced that report to the governor, presented it directly to him in January of last year, shared it with the legislature, and they established 5 bold goals that are focused on housing, health, equity, caregiving, and affordability. And beneath those 5 goals are hundreds of initiatives and strategies, and you'll see in the chat, you can link to that information. It's a 10-year roadmap for our state. So we are just getting started with tomorrow's 1-year anniversary. We're just beginning, and we could use your help to take it to the next level. So that's why I want to be sure I hear from you today. So in addition to celebrating the master plan, we're also celebrating the release of the governor's budget on January 10th. And there were a number of items contained in the January 10th budget proposed for action together with the legislature. A few of the highlights. This budget builds on last year's budget that had historic, unprecedented investments in older adults, people with disabilities, housing, homelessness, home and community-based services, record expansion of Medi-Cal, SSI, SSP rate increases. But this year's budget, the one that came out just last week, includes $1.7 billion in new funding for our workforce. If we want to build the home and community-based services that we all seek, it relies on a workforce, a qualified workforce, home care, social work, nursing, physicians, the whole gamut of the workforce is included in this $1.7 billion of new funding that's proposed. There was a decrease in the Medi-Cal premiums for the working disabled. $248 million was proposed for IHSS backup providers. And we saw full expansion of Medi-Cal in the governor's January 10th budget. First state in the nation to do that. So another thing we're celebrating in January is at the beginning of this year, the federal CMS, that's the Centers for Medicare, Medicaid Services, they oversee Medi-Cal in our state. They approved California's CalAIM waiver request, and they also approved our state's $5 billion home and community-based spending plan. So when you put together CalAIM and the home and community-based services spending plan, this is going to transform our network around the state. And it allows for things like community supports that have not been funded previously, for expansion of programs, for stronger linkages between housing, health, and social services. It funds respite, nursing home transitions, personal care over and above IHSS, home modifications, meals, and a whole variety of services and supports. So those are the highlights just this month. It's only the 20th, and those are all things that have happened in January already. And as I started, I did want to step back and talk about what is going on right now with the pandemic in our state and the widespread infections that are happening, and to make sure everybody on this call knows how you can access 4 free tests for every household through the Biden administration. and to also talk about our outreach and continued outreach and activity to make vaccines available to every Californian free of charge, including through My Turn, where we're able to bring vaccines and boosters to people's homes for people who do not have transportation or who are homebound. And how we're expanding testing opportunities, first and foremost in our state's long-term care settings, nursing homes, adult care homes, residential care facilities for the elderly, to make sure that they have adequate testing kits on site and available to protect residents, staff, and visitors. And then the last thing I wanted to close with before I open it up for any questions or comments is, it's just a privilege to work for the Department of Aging, and I wanted to share, a bit about our vision for the future, where we have a no wrong door system, or some might say a one door system. When you think of a no wrong door system, it's you can go anywhere to get anything, or a one door system where there's, one place you go to get everything. But we're deeply committed, and this governor is committed to a no wrong door system. Secretary Galley is committed to it. We've had investments in our state budget in the last 2 years, and even in the January budget, that support our aging and disability resource connections, which are collaboratives between the area agencies on aging and the independent living centers, so that we can provide more services and supports to the community, and to really be responsive to the needs of our communities. Information, assistance, referral, assessments, programs and services, and the supports that people are looking for, and critical linkages to other supports like mental and behavioral health, housing, transportation. So we're very excited that at CDA earlier this year, just a couple weeks ago, we expanded our ADRC network. We now have 15 designated aging and disability resource connections in our state. We have 9 that are considered emerging, and combined, they serve over half of our state's population. So expanding that network is a key priority of mine, of the Department of Aging, working in collaboration with Director Joe Xavier at the Department of Rehabilitation, and within the California Health and Human Services Agency. So we're very excited about what's to come in our no wrong door system, and I'd love to take any questions or comments so you can help inform and educate me in my first 90 days on the job. Thanks for the opportunity to join you.
Thank you, Director DeMarois. I really appreciate the information that you provided, and congratulations on making your first 98th day on the job. I'm glad that you could join us. A couple of follow-up questions. What is the website when you say there is no wrong door? That I'm assuming there's some sort of a central intake location that person can go to receive whatever that they need. So if there's, I know you posted a whole bunch of websites here. That's really helpful. So that's one. Number two, some of us are not fully familiar with the CalAIM waiver. Could you briefly tell us what that is about? And then we can move on.
Sure. 2 excellent questions. Thank you. So the first, with the no wrong door or the ADRC, we can link you to the California Department of Aging website that has general information. And then at the local level in your community, it might be an agency or entity that you're already familiar with. I'm thinking of Freed in Placer, up in my area near Sacramento. Freed might be an example. Or it might be your area agency on aging, or it could be your county adult or health and human services agency. So some are public, part of the county system, some are nonprofit agencies, and some are a hybrid between the two. To your second question, for a couple years now, California was really at the forefront of expanding through the Affordable Care Act, taking advantage of every Medi-Cal expansion that was possible. And that's been a continuous trajectory of our state, to do everything we can to expand Medi-Cal and make the most people eligible for the greatest number of benefits. And I think IHSS is, such a great example of, we offer through IHSS to Medi-Cal beneficiaries something that other states have never even considered. Part of how California was able to achieve that over many years' time is we had a lot of waivers with the federal government. So anytime there was an opportunity, we seized it. Our Medicaid director, J.C. Cooper, and our Department of Healthcare Services director, Michelle Boss, are genius. And they found a way. They wanted to have one waiver that covers all 58 counties to make things more uniform, more consistent, so that we wouldn't be in situations where neighboring counties didn't have access to similar services. And key to our waiver approval, what is known as CalAIM, is to partner directly with managed care health plans in our state and to enlist them as partners so that Medi-Cal beneficiaries receive better care coordination, care management, case management, and in the case of older adults, where Medi-Cal and Medicare are better integrated, so that the home and community-based services and the hospitalization are linked more closely. So that is the Medi-Cal expansion, and our team in California pushed on the federal government to include, as many community supports as we could under the umbrella of Medi-Cal, to see the whole person. We did a whole person care pilot over the last 10 years, and we saw that so many social supports and community supports that people need that improve their health and lead to better health outcomes. So those would be the things like respite, nursing home transitions, home modifications.
Thank you so much. One follow-up question about this. You also mentioned, which is very relevant now, is about the testing that you're making it available because of the Omicron virus is running rampant at all the care homes, nursing homes, and so on. There has been reported problem, the supply chain issue with those testing kits and so on. So how are you meeting that challenge in the delivery of these kits to these various locations?
So something that's different about, or something that's happening now, is every state is grappling with this at the same time. So what you're commenting on about the supply chain is that the rapid tests are in demand across the nation. And we had seen before where there had been sort of waves around the state. And so now they're in high demand everywhere. They're high demand for schools, high demand for the workplace, high demand for healthcare settings. And the high infection rate of this variant is causing, creating the need for more testing more frequently. So there's the federal approach, and the Biden administration's website that was launched this week, where every household can access 4 tests and go online or call for those tests, is one part of the dissemination process. And then in California, we have our 58 county public health network, where tests are being made available. We have through the Health and Human Services Agency, we have our nursing homes and our residential care facilities, adult homes, where we're working, as we speak, to secure tests to make those tests available to those settings, so that they can pick them up at convenient locations in their communities. And so those are the large scale efforts. And then there are the other, individual, regional, or organizational efforts that are also underway to supplement that.
Thank you. And you also mentioned about the expansion of IHHS, which is, I guess, is in-home supportive services where people need help in meeting their basic daily things. In that setting, how are the care providers are getting the testing and so on, the resources that they need to deliver the services at these homes?
You know, that's one that I will have to research for you and get back to you. I don't know what the mechanism is for IHSS, how the individual IHSS worker or the individual who employs the IHSS worker secures the test. So I'll have to follow up for you on that and get back to you.
Great. Thank you so much. I don't have any questions. Do we have any questions from the audience for the director to respond to?
Hi, this is I'm the SDAC secretary. This is Susan Turnquist. Another Susan. I always like to ask, since this is your first time here talking to us, so the people you're talking to right now, we are state of California workers who are in disability advisory committees for our agencies, and also the EEO officers for our agencies. How can we help you get along the messages that you're trying to put out there, make sure that people know about your services? What are your recommendations and the best ways that we can make sure that our disability, our persons with disability that we're trying to advocate with know about your services? Do you have any suggestions? That's my first question.
Good. I hope you, and more questions to come too. So I think, putting where I work for the California Department of Aging, we can share with you, we have a single line, a single point of entry for our department, an 800 number that people can access. And through that number, they will be routed to one of 33 area agencies in the state. And I would say that, for anybody on this call, or if you have family or friends who need these services, that's where you would get started with our 800 number. And then I think to the second part of, in terms of supporting our staff colleagues, having resources, you are a key resource to me as we work in our department at the Department of Aging. And I know I have a few colleagues on the call here too. We're really trying to expand our focus to be more inclusive of disability in employment and supporting our employees. And so we're looking at, a number of things within the agency and with our staff, and with the hiring of an equity officer on our team who will include disability as part of that role. And that's never been included previously. We've never had an equity officer in our department.
Great. That's always awesome to hear. Yeah. And I guess I'll follow up on that question with, because where we're going is, what you've heard is our agencies, our DACs, we have opportunities to lunch and learns, or in our disability advisory committee meetings, we can have presentations. Does your agency have outreach that we can reach out to if we want to hear more about currently what's going on with you, so that we could, help publicize within our agencies the information you're trying to get out? That's always useful for us if we know people that are willing to give speeches and presentations to us.
That is music to my ears, Susan. And we would do one a month for you on a different topic every month if we could. So that's a big part of our role, is, really to educate the public. And I can think of a number of ways, for instance, we have a program called HICAP, the Health Insurance Counseling and Advocacy Program. And so we provide, information about how Medicare works and how people can access their Medicare benefits. And we have caregiver supports. So anybody who's caregiving for a parent or an older adult or someone with disability. So we would love the opportunity. We could even do, a lunch and learn just about the master plan for aging and the 10-year blueprint for our state and what that means.
Absolutely. That's the kind of stuff that it's like, I know that you're trying to get information out. You have the opportunity here to connect. Could you make sure that that information on how to contact the right people is put in our chat or given to Bobby so that we can disseminate it to our DAC members that are here so that they can know how to reach you guys? Because that's really, you know, how do we help you so that, and you help us by us learning more about each other is something I think is important. And Bobby, that's the end of my questions. And I don't see any other questions in the chat.
I have a question. Hello? Oh, yes. I'm sorry. My name's Lucy Chaidez. And I have been trying to get a hold of several different state departments by telephone because my personal I don't have right now a personal laptop or a cell phone that I can use. And what I'm finding is that I can't find telephone numbers to get any kind of help. And they all ask for emails. A lot of them don't even show telephone numbers. And I'm sure there are a lot of people like me who don't have access to a personal laptop or a telephone. Or a cell phone. So and I'm very resourceful. And I have been so frustrated for the last 3 days trying to do something. It's been a personal issue, but I don't know what to do. Don't know how to get a hold of people.
Yeah, and is that something, Lucy, that you're trying to work within state government and something like 211 or our department's 800 number wouldn't be helpful to you?
No, I've just been trying to get a hold of there are a couple different departments and also federal departments regarding an issue, and it has to do with COVID, and it was personal things. So I've been doing this not during work, and I won't use my work laptop either. And it's making me crazy because I can't get like I said, I'm very resourceful. I'm really good at researching, but I just can't get a human on a telephone or even a telephone number. It's very frustrating.
Yeah, and I think, part of that also might be, I saw in your, telework is a topic of this group, but I think whether it's the federal government, the state government, or private sector, that with so many people working remotely now, I think that has been, one of the consequences. But if there's anything that I could help you with, I just put my email in chat and would be glad to help direct you, and without knowing, specifically what you're looking for and who could be most helpful.
Yeah, I worry about people who, because I'm pretty resourceful, I worry about people who really don't have a lot of resources to work with, who can't get the information they need because they won't be able to get a telephone number and they can't email. I'm sure there are a lot of people out there who don't have those kinds of resources. So anyway.
Yeah, and that's, another big investment made by the governor and the legislature in the last, 2 years has been the digital divide and broadband training, equipping people with technology and equipment. So, that was that is still a big learning of this pandemic is the lack of access that people have as everything moved to technology. So, that's something our department is involved in issuing, iPads and other technology tools and devices to older adults and people with disabilities, and to provide training and support and assistance so that they can use those devices.
Oh, that's excellent. Thank you.
This is Bobby again. I just want to follow up on your last comment. Earlier on, Director Joe Xavier was here, and we asked the question about the technology and the training and the assistive technology that many of us might need. And you just touched on one of the areas we discussed earlier, and that is you also provide a similar service in terms of providing technology. And do you also provide training? And how would one go about receiving those benefits if they're disabled and in need of that?
Yes, so our mechanism for distributing that is through the 33 area agencies on aging in our state. And they are helping us identify individuals who need that support, who need the devices, and then and then the training is provided because a device that sits on a counter isn't useful. And if somebody needs help with internet access and then training on how to use the device, that's part of what we're using state and federal dollars for.
Great. Thank you so much. Really, we have all benefited from your wisdom and the knowledge sharing that you provided here today. So thank you again for visiting us. I hope you come back and see us soon. And we will continue to share the links and everything else that you can provide to us with the rest of our group. So thank you, and have yourself a fantastic day.
Thank you. Thanks for the invitation. And tomorrow, when we celebrate the 1-year anniversary, the last thing that the governor says in his video is, together, we're just getting started. So this is the beginning, I hope, of many conversations that we have, and I can learn from you, and I'd like to know your resources to share with our team and vice versa. So I'll see you again.
All right.
Thank you.
Okay.